Welcome. My name is Peter Strong. I'm a professional psychotherapist and I offer online therapy, which of course is very convenient and necessary if you're suffering from agoraphobia or other uh, anxiety condition that keeps you housebound. So I'm often asked, what is the best treatment for agoraphobia? What's the best way to overcome the anxiety and panic attacks that accompany agoraphobia? From my experience working with people suffering from agoraphobia over the last 10 years or so now, I find that the best approach is what I call mindfulness therapy. This is a system of work that I've been developing for many years, which really works at the underlying core level of your anxiety. It helps you break free from those patterns of habitual reactivity that cause your anxiety. It works by changing the anxiety directly so that it is not habitually triggered by the common triggers that you encounter in your agoraphobia. So we have to uncover these underlying anxiety habits and then work on changing them. And the best way for doing this is what I call mindfulness-based exposure therapy. So this means that you actively create a series of exposure challenges that might be walking around the block or driving a short distance if you can still drive, or even just stepping outside the front door. It doesn't matter what the challenges are, but it is essential that you identify challenges that are accompanied by a degree of anxiety, and then start working on those challenges and training yourself out of the reactive anxiety that has become habitual. The way that we train ourselves out of the anxiety reactions is not by simply repeated exposure, as is often taught. Repeated exposure is very inefficient, and you risk intensifying the anxiety. So in mindfulness-based exposure therapy, we prepare for each challenge in a very thorough way before you do the challenge. And this preparation is called a rehearsal meditation. It's all about training. So in a rehearsal meditation, you imagine doing that challenge, and then you look specifically for any anxiety that gets triggered. And then you start to work with that anxiety, working with its structure and helping change that anxiety directly. Not through a CBT type model. It's completely irrelevant whether your thoughts or anxiety is rational or irrational. That is not the point. The point is, can you identify the fear, the emotion itself underneath those thoughts, and can you help that fear heal? That's the focus of mindfulness therapy. We focus on the emotional content much more than the thoughts. The thoughts are simply reflections of the underlying fear or anxiety. So when we work with this anxiety that we can provoke by imagining doing the challenge, we look at the imagery of the anxiety. That's a very important feature. So this is called the structural theory of emotions. This is a system of work that I have developed as part of mindfulness therapy. And the structural theory of emotions states that emotions have a structure in the form of internal psychological imagery. How you see the fear or anxiety in the mind is what actually causes that fear or anxiety. The intensity of that anxiety is determined by the imagery. So if you have very intense anxiety, and perhaps so intense that it provokes a panic attack, then you can be quite certain that that imagery will be very large in size, and it will have the ability to consume you, to be overwhelming. It must be large to be overwhelming. It cannot be overwhelming unless it is very large in size. So that's part of its imagery. And there are many other properties of that imagery that actually determine the intensity of the emotion. So we investigate these properties. We look at how large the imagery is. We look at the position of the imagery. Where do you see it? Where do you see your fear or anxiety? We look at its color. Certain colors will provoke more anxiety than other colors. So all of these properties we investigate in great detail. When we learn more about the imagery of our emotions, we can then move to change that imagery. We begin to explore different imagery and see what changes help that emotion subside. And when we interact skillfully with the imagery, we can reduce the anxiety to a level where it's neutralized and no longer problematic. So that's all part of the preparation, the rehearsal meditation that we do before the challenge. And you might spend 15 minutes a day for 2 or 3 days before you actually do the challenge. It's preparation, that's the important message here. You must prepare well for each challenge. Then you do the challenge, and what you have learnt during your rehearsal meditations begins to take effect in a natural, spontaneous way, like any other learning process. When you've trained well, that training comes into action quite naturally during the actual challenge. Then we might meditate after the challenge as well, so we can work with any fresh anxiety that arose during that challenge. And we do the same thing. We look at the imagery of that anxiety. We look at changing that imagery to resolve that anxiety. So really, the structural theory of emotions basically is telling us that the real problem is that the imagery of our emotions has become frozen or stuck and has not adapted and changed over time. And the purpose of our mindfulness meditation is to unstick or unfreeze that imagery and help it change in a direction of healing. So that's working with imagery, which is a very important part of mindfulness therapy. See, mindfulness itself is really simply looking closely at the mind, at experience. It's seeing what is actually there rather than making theories about what you think is there or reacting out of habit to what is there. It's looking directly at what anxiety actually is. And when you do that, from my experience, you will see it's primarily imagery. So that's a very important part of mindfulness therapy. The other more conventional and ordinary part of mindfulness therapy that's of course very important is to look at the habitual reactive thoughts that feed the anxiety. And so we learn to identify those thoughts, and we learn to neutralize those thoughts by moving them or changing our relationship to them so that they are no longer overpowering. And that will also involve working with the imagery that is provoked by those thoughts, the imagery of the fear or anxiety that accompanies those reactive thoughts. So we work in this way with the mind, training the mind to resolve anxiety itself. And these new pathways that we establish in that training become automatic. And the end result is that we do not experience anxiety. So that's the mindfulness-based approach to treating agoraphobia. It's very effective, and people usually see quite substantial changes within 3 or 4 sessions. Once you start applying these principles and working with your fear in this very strategic way, you'll soon start to see big changes. And of course, like any training process or learning process, the more success that you gain, the faster the rate of change and improvement. So very quickly it starts to gain momentum, and you find yourself breaking free from the prison of your fear. And agoraphobia is in many ways best described as a prison of fear. So if you would like help with your agoraphobia, please contact me and let's schedule some therapy sessions over Skype, and I will teach you exactly how to apply mindfulness to overcome your agoraphobia. So please contact me if you'd like to get started with the mindfulness approach to overcoming agoraphobia. Thank you.